keeping our distance from one another and staying at home does help prevent the spread of COVID-19. But those methods are taking a toll on people battling addiction. WCPO 9 News reporter Sina Gebriab shows us how the pandemic is restricting their treatment and what local recovery centers are doing to make up for those losses.
A number of treatment centers, including Greater Cincinnati Behavioral Health Services, haven't completely closed their doors, but they have had to change how they provide care. Now, those changes are causing a lot of anxiety and stress, and that alone can be a trigger for people fighting addiction.
Now more than ever, I worry about them, getting stressed out and not calling and reaching out. I worry about their safety.
Recovering from addiction is already an uphill battle, and without group therapy sessions or meetings for groups like Alcoholics Anonymous and Narcotics Anonymous, there's a greater risk of relapse.
When they're here for, 3 times a week for 3 hours each day, we take that away, and that group dynamic of support, that has been really significant and really hard for our clients.
So to fill that void, Alicia Fine with Greater Cincinnati Behavioral Health Services says her team is conducting more one-on-one sessions over the phone or via video chat.
We are proactively reaching out to every single client that's open with our services. So our counselors are pursuing people.
Including peer recovery coach Chris Miles, who's been sober for almost 4 years herself. She says these days her phone is ringing round the clock.
I get calls at, 11 o'clock at night with clients, asking me, where can I get on a meeting? The anxiety is very real. It's real for all of us in recovery.
And according to Miles, within the last couple of days, more virtual AA and Narcotics Anonymous meetings are taking place on video chat platforms like Zoom.
And it's just growing, constantly growing.
But for people who don't have a phone or computer, there are some solutions in the works.
Those are some barriers that we're still trying to break down. We're giving thought to maybe we need to give people phones, little, disposable phones.
We have had to make adjustments to the way that we are doing things right now, but we are not going anywhere. We're still going to be here.
Now, anyone using medication as part of their treatment can still come here and pick up their prescription on site. They're also still opening their doors to anyone who wants to begin treatment. And if you go on WCPO.com right now, there's a full list of virtual resources for anyone in recovery. Reporting in Cincinnati, Sina Gebriab, WCPO 9 News.